Hello guys, as we're moving through all these GPRA measures, we're kind of moving along into basically the cancer bundle, and we're going to take a look at three of those measures coming up here. We're going to take a look at PAP, mammo, and colo, so looking for cervical cancer, breast cancer, and colorectal cancer and screening. A lot of these are all performed the same way, but I'm going to break them down for denominators and logic and stuff. So the first one that we're going to look at is PAP. So basically, when we look at female active clinical patients ages 25 through 64 years without documented history of hysterectomy, patients must be at least 25 years of age at the beginning of the report period and less than 65 years of age as the end of the report period. So basically, they're looking for a PAP smear in the past 4 years. And there's a lot in here. You can look at the CPT codes and what for hysterectomy and whatnot. But basically, there's going to be about three ways. You're either going to perform it there, and you'll see a lab resulted coming in. We'll enter it. We can enter it historically, or we'll do a procedure. So these are one of the ones that you can do even in the smaller clinics right there on the spot. So let's take a look at some of the ways that will get into this super bill. So the first one is you can just add it at the visit that day. So if I just search for it, I should get pretty close to getting into that area. The other one, though, that I'm going to want to take a look at is perhaps you can put it over here on a pick list. So I don't know if I see it just yet in here, but you could actually add it to a pick list by going to your super bills, picking the one that you want. You're going to add. You can add that to it and then put it into the actual pick list itself to where it'll show up here. You might even bunch them all together, like cancer screening bundle or women's health is where you could have a couple of those, and you can put it in there into a pick list. The final one, which you're probably going to see a lot more of in small clinic areas where you actually refer out for these kind of things like colonoscopies and stuff, is going to be in your historical services. So with your case managers, you can go through, get this list, see who's due, send them out, and then maybe a couple weeks later look to see if those have been resulted yet, and we can add those historically. So this is a pick list that is, you can go into super bills and find that. It'll be called GPRA services, but you can go in here and you can enter an historical, find out where the historical was performed and at what time. Let's go to a location, other, Kenai. Whoops, might help if I spell Kenai right. And then let's pick a date, and it's done on that date. Save. But that's basically the three different ways in here that you could actually enter that this was performed. Thanks.